For many of us, our skin is something that we basically take for granted. Sure, we worry about the odd blemish, pimple, age spot or wrinkle, but in general, after we've done our morning care, we don't give our skin a second thought. For about 1 million Canadians living with psoriasis, that is but a dream. Dr. Lind, let's start off by describing what actually plaque psoriasis is.
Well, there are many different types of psoriasis. The most common type, affecting about 80% of people, is what we call plaque-type psoriasis. And these are lesions on our skin that are often very itchy. They can even be painful. They're often red and quite scaly. A lot of people, because they're itching and painful, are scratched, and they may be oozing even blood. The most common places that they occur are in the elbows or knees, scalp, but essentially some people have it quite severe and they have it all over their body.
So, Stephen, is Dr. Lind's description of psoriasis consistent with your own experience?
Yes, that's very accurate. I was first diagnosed when I was 13 years old. I've had psoriasis now for close to 20 years, and it was a very difficult time for me in high school and growing up into my 20s. It's very hard on your self-esteem and your self-confidence. A lot of the time I would wear hats, long sleeve, even in the summer.
To cover up.
To cover, yes. People, looking at you, making remarks, exactly.
Insensitivities.
Right.
Yes.
So it's very difficult for a young man to go through.
It must be just tremendous, It must be really hard. Dr. Lind, I know there are a variety of treatment options available for patients suffering from moderate and to severe psoriasis. Could you tell us a little bit about the different treatment options available for patients?
Yeah, there are quite a number of different treatment options for psoriasis. And as we talked earlier, this is a chronic disease. This isn't a disease that you can cure. I often tell people, I don't have the cure, but I have ways of controlling it. And there are a number of different ways you can go. There are different topical things. As you begin to get more psoriasis, and certainly this gentleman's told us that he had more than just a little bit of psoriasis. Sometimes we do try phototherapy, and for some people it does help, but it's time-consuming and difficult often to get there.
And not everybody gets there.
And then it's a bit like moving up a ladder, if you would. There are drugs that we've used for a long period of time, and these are called the traditional systemic drugs. And these are oral medications. More recently, because of our understanding about the immune system, we've got kind of designer drugs now. We have special drugs called biologics that are special proteins that are injected subcutaneously. They can be infused. Each of them, we luckily have several that can be used, and each of them can be beneficial for some people and maybe not as beneficial for some other people.
Right. So, Dr. Lind, these new biologics, if a patient would want to go on one of those, could they go to their family physician, or should they really go to a dermatologist?
Well, they really should go to their dermatologist. The dermatologists are the people that know about this. Certainly, some family doctors might know about it. It's something that family doctors wouldn't be prescribing, something that dermatologists prescribe and know the ins and outs of how to do that. In our system, however, you often have to be referred to a dermatologist by the general practitioner. So this is, again, where the public needs to be educated, the patient with the psoriasis being educated and knowing that they'd like to talk to somebody about this particular option. And so sometimes they can talk to the family doctor, and the family doctor will send them. Other times there actually is a website, www.livingwellwithpsoriasis.com. And that one, there actually is a drop-up where you can actually find a dermatologist, potentially in your area. If there isn't a dermatologist in your area, then you might then go back to your family doctor and ask, is there somebody that they know about this?